What's up, YouTube? Welcome to another episode of the Undergrad Forum. Now in this video, we're going to talk about the one technique you need to know to do well on the clinical years of medical school and all throughout residency and arguably also in your attendingship, and that's called the box checklist technique. Used by everyone, super simple. Let me show you how it works. You gotta get a piece of paper. I like folding mine in half. You don't have to, but you'll realize everyone's got their little tweaks. Okay, so say you're in the hospital, you're seeing patient X, whatever, right? So you got patient X written here, right? So patient X, and now you're like rounding, you're talking to your resident, or you are the resident and you're preparing for the patient, you're going through the charts, and you're thinking of things you need to do. So here's all the clinical years of medical school and all residency really is getting the necessary work done for the patient. Yes, you got to see the patient, you got to get the history, you got to do the exam, you got to write the note, you got to get a good assessment and plan, you got to put in all the orders. But getting the work done at the end of the day is the most important part to being a resident. You just got to get the work done, get the patient taken care of, send them on their way, happy as a clam hopefully. So, how do you not make errors and how do you not forget things? That's the most important thing. If you can remember how to get everything done, you are a star. Simple. So, say you're like going through the computer, you're like, oh man, this guy kind of got a high white count, he's tachycardic, looks a little hypotensive, this guy's sick. You know, what are you going to do? You're like, oh, I need to get a UA. Okay, make a box, write down UA. You're like, oh, I should probably get a chest x-ray too. Simple. All we did was write down, we put a box, we wrote down what to do next to it. And what if you sit there and like, you know what? I gotta talk to social work. This guy might be a dispo problem. All right, here, input, discuss with social work. That's simple, nothing complicated. Why is this called the box check technique? I put a box next to what I gotta do. Then what do you do next? You put this in your white coat or whatever, you go doctoring around, you do what you gotta do. The day is going around, you pull this thing out, you're like, oh man, for this guy, I still gotta get that. So you put in the order for the UA, once it's done, check it off, done. Don't need to worry about it anymore. And then you're like, oh yeah, gotta get the chest x-ray too, put that order in, done. Oh, I gotta talk to social work. Go over there, talk to social work, case management, hey, can you help me? Whatever. Once it's done, oh, now I gotta do something else, thanks social work. So check off I talked to them, but now I gotta place an order for a wheelchair. Okay, write that down. Once it's done, check it off. This is the point. This is said by one of my older mentors and I loved it. He said the key to being a resident is you don't get to go home until all the boxes are checked. And he's right. Something as simple as this is how you get through residency and how you are a rock star. Getting the work done. Of course, with time, you're going to interview better. You're going to do exams faster and more focused. Your plans are going to become more refined and really fine-tuned. But just being able to get the work done really is the core component of residency. If you can't get all the orders placed and the patient taken care of, you've got a problem. But if you can do that well and manage it, and every resident, I argue, uses this same box and checkmark technique, then you're on your way and then you can kind of evolve your practice and get more into the fine-tuning of the plan, doing better exams, reading imaging better, etc. But if you can't get the core work done, you're handicapped all day. Now, some of you may be listening, maybe you're a third-year medical student and you're like, man, I carry like 2 patients. Like, all right there, man, I'm a doctor, right? Kinda. The problem is, yes, a lot of us do remember a lot of things. But once you really are busy, you're carrying a large load of patients. Some of you have 10, some of you have 30, some of you are operating, some of you are consult, and you have a floor to manage. It gets busy. So you're taking care of a lot of patients every day. And the reality is you're going to forget stuff. It's life. You're seeing a patient, you're like, oh, I gotta put in these orders. Someone pages you, hey, for the patient on the floor upstairs, can you put in restraints? Can you replete the K? You're like, okay, fine. You'll try to do that too, but you got a patient sitting in front of you, you're getting paged, there's someone in the ED waiting, maybe there's a stroke code, maybe there's a code blue. It's gonna get busy, you're not gonna remember it all. So for every patient, simply do the box and checkmark technique. You will dominate the 3rd and 4th year of medical school. You will be an excellent resident because getting the work done is the core to everything. If at the end of the day, someone looks at you and says, you know what, this person is good in that they do everything they need to. Then you already got most of the work done. Now just, fine tune your doctoring and you're on your way. Super simple technique. Everyone uses it. If you're not using it, use it. There's no discussion, I'm sorry. I'm not always this bold, but it's just that useful. You're going to be carrying a lot of patients. You don't want to forget stuff. And also, if it's on here, you don't have to keep trying to carry it up there. You can free your mind and think about other things, get innovative, do patient care. Let this be the simple, dumb kind of to-do list while your brain's free to do other work. Hope you guys enjoyed this video. Use the technique. You're going to thrive with it. And as always, enjoy your studies.